What up? It is your boy, Drugged and Dying, back at it again, and I wanted to talk about a very general subject, and that is dependence versus addiction. And this is a really important distinction to make in the very challenging climate that is pain politics, if you want to call it that. Why does this matter? Because these two terms are often thrown around interchangeably, it paints patients who are responsibly using these substances in a very bad light, as well as lumping them in with people who abuse these substances. Addiction is characterized by an inability to control one's use of a substance, an inability to stop the escalation of doses, and the inability to stop despite apparent harm to oneself and those around them. So these are the three main characteristics that differentiate dependence from addiction. And these are important to note because people are going online, people who are having a huge influence on how patients receive medication, how people perceive medication as a society, how we stigmatize medication. When Andrew Kolodny says heroin pills over and over again, but pushes Suboxone, it's a very weird thing. And it's important that, I don't know what to say about it. I guess I'm gonna have to do a whole video on him eventually when I get this going. But now there's also some weird stuff going on with a term cooked up by Purdue called pseudo addiction. This is very interesting, and not gonna lie, I saw the John Oliver video. That was the first place I saw it, but that's not the first time I had seen these promotional videos. It's just there's a few of them, and he picked that one. But he showed a clip of a promotional video for OxyContin by Purdue Pharmaceuticals. He showed a video advertisement that said that patients will present with symptoms that seem like addiction when they're really just seeking pain relief. And it was a very weird, it was, this is why we're in the current political climate we are with opioids, because these companies made doctors feel comfortable pushing these medications. They lied about the addiction rates, they lied about the duration, they lied about they withheld information, and they did not yeah. So with any substance, whether it be opioids or literally any class of medication, there's dependence on a vast majority of these medications. Some have no dependence, no withdrawal, no, nothing like that. But many medications do. SSRIs, many antidepressants and psychiatric medications, pretty much any psychiatric medication you can name that I've been on has withdrawal symptoms in some people. But SSRIs, antipsychotics, Jesus, fucking benzos. But that's a whole other thing. You all know, I'm sure, that seizures and fucking, it's crazy. But yeah, pretty much every pain medication, muscle relaxants if you take them long enough. I mean, yes, so withdrawal is a thing. There's hyperalgesia when we're talking about pain medications. I was speaking generally, but this is the focus of this talk. Hyperalgesia is the heightened state of pain sensation. When I withdraw from my pain medications, be it literally anything that affects my pain, opioids specifically is obviously what this is stemming from, this whole, line of thought. And dependence on opioids and chronic pain patients who are dependent on opioids by nature of their situation. This is a choice that they made, that their doctors made. Maybe they just followed the doctor's instructions and didn't really pay attention, which is dumb. But this is a decision that they should have been very consciously aware of, because I'm sure their doctor talked to them all about the risks and such, and the fact that there are withdrawals. But when you are in pain chronically, you should make your own decision because it's your own body, is what my opinion is. But if you can do with less medication, then it's better. But if you need medication, then take medication. There are people that need opioids daily in high dose ranges. And these people aren't any worse than you or I because they're dependent on a medication. But it's just, it's unfortunate that that distinction is what some people use to differentiate, addicts from, pain patients that are not character flawed, individuals with character flaws. But and it sucks because it's pain, and that's so visceral, and it feels like torture when they do things like cut scripts and treat people like this, like they're doing. But it's important to make this distinction right now because of everything that people are saying. Because Andrew Kolodny is going on Twitter and saying that heroin pills are being... Jesus Christ. It's just, there's too much. I don't know how to... you want me to make an hour-long video about this whole thing that is really rambly, but I'll cut it up really nice, then put a comment. Don't forget to click away the second the person starts telling you to do a bunch of shit. I don't give a fuck if you like or subscribe to this channel. If you want to hear me rant about issues that I think are important surrounding pain, drugs, mental illness, I'll be here. So until next time, I will be over here drugged and dying. Bye.